right, I'm going to go ahead and practice some skills. The previous video went through the HEENT physical examination. And I'm going to go ahead and start, I'll just start from the top again and practice some skills. So the first, when I come in and greet my patient, I'm going to look at the general survey. Appears awake, alert, oriented, well-groomed, dressed appropriately for the weather. I'm going to take a look at the head, look at the shape of the skull. I'm going to look at the facial features. I'm going to inspect the skin for any abnormal lumps, bumps, bruises, lesions. And we did note a small papule on the right posterior scalp area that he's had his whole life. So no recent changes in it. Anytime you find a lesion on the skin, you want to look and assess for the ABCDE, asymmetry, border irregularity, color, diameter, and elevation and evolution. And if we were to find one of those, you want to take a closer look, maybe ask some more questions about sunscreen use, exposure to sun or chemicals, any history of skin cancer, any family history of skin cancer, and anytime you see any moles or anything on the skin, it's always a good opportunity for some health promotion, and recommend the use of SPF 30 or greater sunscreen anytime there's going to be sun exposure. So moving on from the head, we'll go ahead and take a look at the eyes. These poor eyes are so sensitive to my brand new pen light, so I'm just gonna kind of pretend without the light. But I'm gonna check the pupils. I'm gonna check the pupils, make sure they're equal, round, and reactive to light, and that there's accommodation, that there's equal changes in both eyes. So I'll go ahead and shine the light in the eye, dim the lights in the room first, and check the pupils, and again on the other side. So I'm checking the pupils, and they are perla. Pupils are equal, round, and reactive to light and accommodation, and they're 4 millimeters. I'm going to check the visual fields, which I'll have, you look at my nose, sir, and we're going to, no cheating, look at my nose. I'm going to hold up a finger, and you tell me how many fingers I'm holding up.
2.
Okay.
1. 2. 1.
You cheated. And 2. All right. I'm going to test for conversion. Go ahead and look at my nose again and follow my finger. Good. So both eyes move together inward. I'm going to check the corneal reflex. Use this little wisp of cotton and just kind of touch it to his eye. He should blink. Good. Good. Also, when I look at the eyes, I don't think I did this in my first video, but I did look at it, but I don't think I said it out loud. I'm looking at the lacrimal ducts, make sure there's no swelling. I'm looking at just the surface of the eyes, making sure that they're moist, and there's not any excessive dryness. I'm looking at the conjunctiva. His are, kind of just pull down and take a look on both sides. Conjunctiva are pink. And I'm looking at the sclera. They are white. If they were red, they could be red if there's any trauma or allergies, or they could be yellow if he had any jaundice, any liver failure, anything like that. So the sclera are white, the conjunctiva are pink. If he was really super anemic, they would be pale in color. And the lacrimal ducts appear normal, and there's no excessive dryness or tearing or drainage or anything like that noted in the eyes. We can check the visual acuity, which we will use my little eye chart. And I'm going to have you hold that there with both eyes. Read to me the smallest line that you can.
4, 2, 5, 7, 3, 9.
Okay. Go ahead with your right eye only. Read to me.
4, 2, 5, 7, 3, 9.
All right. And now we're going to go ahead and do that. Same thing with the left eye only.
4, 2, 5, 7, 3, 9.
All right. So we checked visual acuity, 20/20, in both eyes, left eye and right eye. Gonna go ahead and check extraocular movements. And I'm gonna have you take a look at my pen here, and I want you to follow it with my eyes. And up, and down, and up to the side, and down. Okay, so good extraocular movements. And all right, so and I think that's it for the eyes. I've checked visual acuity, extraocular movements, corneal reflexes. I've checked his pupils and the ophthalmoscope exam. Where we go ahead and dim the lights in the room, and gonna just kind of check here. Now look inside. I'm looking to see if I can see the fundus and the optic disc. And then I'm going to go ahead and examine on the other side. Looking for any hemorrhages, no vasculature, any paleness inside. So that concludes the eye exam. Next we'll do the ears. The ears, we're going to first examine the external ear, the auricle, the pinna, make sure there's not any lesions, lumps, bumps, or bruises. No drainage noted from the ear, nothing abnormal on the external ear. I'm going to go ahead and take a look on the inside. We're going to look at the tympanic membrane. It should be pearly gray. He does have some redness on this ear, but I think that's kind of chronic from frequent ear infections. Kind of the top right area of the TM is a little bit red. I can visualize the malleolus, and there's a little bit of cerumen in the ear, but the canal is patent. There's no impaction or anything like that. We'll go ahead and take a look at the other ear. Again, examining the external ear first. Taking a look, the auricle, the pinna, there's no lumps, bumps, bruises, rashes, lesions, drainage, or anything like that noted on the ear. I'm going to use my otoscope and take a look inside. I'm going to pull up and back and look inside the ear. And I'm looking at the tympanic membrane, which is pearly gray. Oh yeah, see the malleolus on this side too. Tiny bit of cerumen in this ear, but nothing impacting. The canal is patent. You're a great patient. Thank you very much. And we can go ahead and test the hearing. The hearing test, we'll do 3 tests of hearing. We'll do the whisper test, the Weber test, and the Rhine test, or Renee, I don't know how you say it. And so when I do the whisper test, I'm going to occlude one ear and whisper into the other. And when you do that, you want to say a combination of letters and numbers, or kind of mix it up a little bit so it's hard. You don't want to say things in a pattern like 1, 2, 3 or something like that. So I'm going to go ahead and block this ear. I'm going to whisper in the other ear, and you're going to tell me what I say, sir, okay?
M47.
Okay. And I'm going to go ahead and do the same thing. Block this ear? Yeah. Sorry. I'm going to block this ear. I'm going to whisper in the other ear.
P62.
Okay. Go ahead and do the Weber test. The Weber test is a test for lateralization of hearing loss. I got my tuning fork. And so what I'm going to do, sir, is I'm going to put this on top of your head, and I want you to tell me if you hear it you'll hear kind of like a soft vibration, and if you hear it in both ears or just one ear, okay?
Both.
Both ears. Okay, so that's normal. That's good. The next test with the tuning fork is the rhyme test, and we're testing for air conduction and bone conduction of sound. And the air conduction of sound should be longer than the bone conduction. So I'm going to take my tuning fork, I'm going to place it on the bone back here behind his ear and have him tell me when he doesn't hear the sound anymore, and then we'll go ahead and put the this part of the tuning fork next to his ear and see if he can hear it conducted through the air versus conducted through the bone. Go ahead and do that. So what I want you to do, tell me when you stop hearing the vibration.
Now.
Can you still hear it?
Yeah.
All right, good. We'll go ahead and do the same thing on the other side. Tell me when you don't hear the vibration any longer.
No.
Okay. Can you still hear it?
Yes.
Okay. Perfect. And we're going to go ahead and move on to the mouth and throat. I'm going to take a look at the mouth, the outside of the mouth. The lips are moist and pink. There's no cracking or bleeding or anything like that. Go ahead and open your mouth, say ah, stick your tongue out. And I'm looking at the oral mucosa, and there is no lesions or abscesses noted. There's a couple missing teeth. 1, 2, 3 on the top. Open your mouth, 1 on the bottom. 1, 2 on the bottom. There's a couple cavities. No bleeding gums or anything like that. And the throat, he has no tonsils, so there's no tonsillar swelling. If his tonsils were there and they were swollen, you'd want to grade them by the amount of swelling. +1, +2, +3, +4 is like touching tonsils. There's no exudate or postnasal drip noted. If I had a tongue depressor, I could check his gag reflex, just kind of shove it in there in the back of the throat, try to elicit the gag reflex. Next part is the neck examination. I'm going to take a look at his trachea. Go ahead and put your trachea out. Trachea is midline. There's no sign of tracheal deviation. I'm looking at his skin on his neck. There's no lesions, lumps, bumps, or bruises. No obvious swelling, no goiter that I can see. I will go ahead and palpate his thyroid in a minute here. I'm going to take a look at his carotids. There's no jugular venous distension. I'm going to go ahead and listen over his carotids. All right, I don't hear any bruise or anything like that. And again. And I can also hear his upper airway sounds while I'm listening over the carotids, and I don't notice any stridor or anything like that when I listen. The next part of the neck examination is to check the lymph nodes. I'm going to use my fingertips and just kind of gently palpate over each area, and I'm looking for tenderness, swelling, if they are movable or fixed, or any abnormality over the lymph nodes. So there's different areas of lymph nodes. Can I have you put your neck up? The preauricular, which is in front of the ear. Posterior auricular, which is behind the ear. Occipital, which is kind of at the base of the skull. Tonsillar, kind of at the side of the jawbone here. Submandibular, under the mandible. Submental, under the chin. Superficial cervical, in the front of the neck, posterior cervical, more towards the back of the neck, deep cervical, which are kind of by this muscle here, and the sternocleidomastoid muscle, and then supraclavicular, which are over the clavicle. An interesting quick story, just in case you're wondering about examining the supraclavicular lymph nodes. When I was in nursing school, my good friend had a swollen, fixed, immovable lymph node above her clavicle, and she ended up having non-Hodgkin's lymphoma, and we literally discovered that in nursing school. So important to examine the lymph nodes. This was a otherwise healthy, 20-year-old gal. Anyway, go ahead and wash my hands after I touch my patient, and I'm gonna palpate the thyroid. So I need to go behind the patient to do that. And gonna feel the thyroid. I'm gonna feel for any nodules, any abnormal swelling or anything like that. My patient here does have a history of hypothyroid, but he doesn't have any history of abnormal thyroid swelling or anything like that. While I'm back here, I should go ahead and listen to the lungs. I'm going to go ahead and listen to all the lungs. I'm going to listen anteriorly. And posteriorly. Go ahead and lift up his shirt. While I look at his back, I'm looking for any rashes, lesions, lumps, bumps. He does have a couple nevi on his back here. Just do a quick count. 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 small, non-raised, kind of just normal looking nevi on his back. Nothing that I would be concerned about. Kind of just running through the A, B, C, D, E in my head, appeared normal, and nothing to worry about, but something to always think about if you ever have any moles that are changing or looking different, you want to get them checked out. So I'm going to listen to your lungs in the back here. Big breath for me. And again. And again. And again. And again. And one more time. All right, the lungs are clear to auscultation bilaterally. I don't appreciate any wheezes, rales, rhonchi, or any other adventitious sounds. And that's pretty much it for now. So that goes through the head, the eyes, the ears, the nose, the throat, the neck, and the respiratory system. Go ahead and pause the video here and do one more after this for my 1 hour. We'll go ahead and do the abdomen and musculoskeletal practicing a little bit real quick. Thank you.